Hey guys, it has been long since we have talked now. So this one is just to remind you one fact that you should have a belief in your knowledge. Whatever things you have read up till now is more than sufficient. Just have faith in yourself, confidence in your abilities, because this is the thing which you will be needing at the final moment, and this may fetch you extra marks. So why not to have this, this confidence is so good now. This may fetch you extra marks, so why not to have this confidence in you. So guys, start wherever you are with whatever things you have and give this game a finishing touch. So we'll continue with the video. Hope it will be helping you. This is Dr. Shivam, and be with me patiently. Thank you. So this figure, it is directly observe treatment short course dots. It belongs to NLEP, that is for leprosy. The programs belongs to leprosy. It symbolizes beauty and purity in lotus, spirit of hope. So this one is National Health Mission, NRHM, which was started in 2005, 12th of April, by Honorable Prime Minister. So it has some targets at national level. Do revise them, and if you want, I'll post in my community section what are the targets at national level for NRHM. This one is NVBDCP, that is National Vector-Borne Disease Control Program. It consists of 6 vector-borne diseases, namely malaria, dengue, chikungunya, Japanese encephalitis, Kala Azar, and filaria, lymphatic filariasis. Now tell me this one. This is National Program for Control of Blindness, NPCB. It was started in 1976 with the goal of achieving a prevalence rate of 0.3% of population by 2020. So it wanted the prevalence to be 0.3% by 2020, which is coming very near. It has some objective. I will post in my community section. Now tell me what program it denotes. It denotes IDSP, Integrated Disease Surveillance Program, launched with the help of Blood Bank in November 2004. The main objectives were integration and decentralization of surveillance activity through establishment of surveillance unit at center, state, and district levels. Second is human resource development. Third is information communication technology for collection, collaboration, compilation, analysis, and dissemination of data. Fourth is strengthening of public health laboratories. So this IDSP continues during 12th plan, that is from 2012 to 2017 under NHM. Now tell me this one is very important. If you are in Delhi, you must have seen one Delhi State Cancer Institute. So it is nothing but National Program for Prevention and Control of Cancer, Diabetes, CVD, and Stroke. The short form is NPCDCS, for control of cancer, diabetes, CVD, and stroke. So it has 2 components. One is cancer, and the second consists of diabetes, CVD, cerebrovascular diseases, and stroke. It has some objective, among which the major are prevent and control of common NCDs through behavior and lifestyle changes, that is non-communicable diseases through behavioral and lifestyle changes. Provide early diagnosis and management of common non-communicable diseases. So do not forget it. It was NPCDCS. Now tell me this one. This is RBSK, that is Rashtriya, not RBSK, sorry. This is RKSK, that is Rashtriya Kishore Swasth Karyakram, RKSK. It was the India's first comprehensive adolescent health program. The importance of it is first adolescent adult program. Adolescents of 10 to 19 year of age are included in this. The strategy or the 7 critical components of it are 7 C's. So they may ask you by giving this figure, 7 C's are coverage, content, communities, clinics, counseling, communication, and convergence. So you can hear it again. So this is India Newborn Action Program, that is INAP, INAP. It was launched in September 2014 with the aim of ending preventable newborn death and stillbirths by 2030, 10-year. Goal 1 is ending preventable newborn death to achieve single digit NMR, that is newborn mortality rate, by 2030, with all states to individually achieve this target by 2035. So overall by 2030, individually by 2035. The goal 2 is ending preventable stillbirth to achieve single digit SBR, that is stillbirth rate, by 2030, and with all state individually by 2035. Now this one is very important, and I think you all know the program, but I don't know whether you know this figure or not. It is Janani Shishu Suraksha Karyakram, that is JSSK. So very popular, very helpful program. So it has two components: pregnant women component and child health component. Pregnant women component consists of free delivery including cesarean in public health institution, free drugs and consumables, free diet, free diagnostic, free blood transfusion, free transport from homes to institution. Child component have nutritional rehabilitation centers, integrated management of neonatal and childhood illnesses, facility based newborn care, triage of sick newborns, home based newborn care. So very important. Now tell me this one. So this is new actually. It denotes the National Program for Prevention and Control of Deafness. So important for you this year. So it has two types of objective: long term and short term. Long term objective is to reduce the disease burden by 25% by the end of 11 5-year plan, and immediate objectives are to prevent avoidable hearing loss due to disease or injury, early identification, diagnosis and treatment of ear problem responsible for hearing loss and deafness, to medically rehabilitate deaf person of all age group, to strengthen the existing intersectoral linkage for continuity of rehabilitation program for deafness, to develop institutional capacity for ear care services by providing equipment, materials and training. Okay, so it was very important. Now this one you all know, it is Mission Indradhanush 2014. So it was launched in December 2014, but the target is for 2020. What is the target? This Indradhanush depicts 7 colors of rainbow, and the target is to cover all those children by 2020 who are either unvaccinated or partially vaccinated against 7 vaccine preventable disease. Now this is the question: what all 7 diseases are there? So you know it is DPT, hepatitis B, measles, polio and childhood tuberculosis. So very easy, you can just remember as you know the national immunization program. So among it, DPT means diphtheria, pertussis, tetanus, then hepatitis B, then measles, then polio, then childhood tuberculosis. Strategy is focused and systematic immunization drive, that is catch-up campaign mode to cover all the children who have been left or missed out. Second is 4 special vaccination campaigns between January to June, okay, with intensive planning and monitoring. Now tell me this is something too much important for now. You must be having ads displayed in your movie theaters for it. So Jindagi Chuno Tambaku Nahi, it is for National Tobacco Control Program launched by Ministry of Health and Family Welfare, Government of India in 2007 and 8. दो ऑब्जेक्टिव हैं इसके. First is to bring out greater awareness about harmful effects of tobacco use and about tobacco control laws. The second is to facilitate effective implementation of tobacco control laws. Okay. Now this is Pradhan Mantri Jan Dhan Yojana. You can all see it. It was launched in 15th of August 2014. Okay, so basically the objective was to ensure access to various financial services like availability of basic saving a bank account and access to services like credit and remittance, insurance, pensions, effective use of technology to allow deep penetration at affordable cost. Now Beti Bachao, Beti Padhao, a very important step for our country. Save the girl child, educate the girl child. So this is implemented through national campaign and focused multi-sector action in 100 selected district with low CSR and covering all states and United Stripes. So it is a joint initiative of Ministry of Women and Health Development along with the Ministry of Health and Family Welfare and Ministry of Human Resource Development. Pradhan Mantri Modi ji launched this program on 22nd of January 2015 from Panipat, Haryana. So I think the date here is important for you. Now this is prevention of parent to child transmission of HIV. Okay, so this is PPTCT, prevention of parent to child transmission of HIV India. Okay, so wait a minute, I'll increase the brightness. I forgot to increase the brightness. Okay, so we were here. Yeah, so if you give nevirapine for this program, it will be single oral dose 200 milligram for mother at labor onset, and for child it is 2 milligram per kg within 72 hours of birth. Now this Suraksha clinic, what type of services they provide? So they basically are a chain of RTI and STI clinic. Okay, that is sexually transmitted infection RTI and STI clinic to provide reproductive and sexual health services. Facilities are blood sample testing, counseling and syndromic case management. So very important, syndromic case management. So what are these kits? These are basically the kits provided in syndromic management. I will give the chart for this syndromic management in my community section. You can go there and see them. These are important, you should know them. Now this is very important program, something which was launched internationally by WHO and UNICEF. It is BFHI, that is Baby Friendly Hospital Initiative in 1991. There are 10 steps to successful breastfeeding, and every facility providing maternity services and care to newborn infant should have certain points. So go through them, otherwise I'll give them in my community tab. My main aim of this is you should know by symbol every program and some important points about them. So this is ICDS. The figure may not be very clear, but you can get an impression of it. Integrated Child Development Services, 1975. It aims at providing services to preschool children in an integrated manner. So basically its beneficiaries you should know ki what age group are all beneficiaries. Children of age 0 to 6 years, that is preschool, pregnant and lactating mothers, women in reproductive age groups, and adolescent girls of 11 to 18 years are all the beneficiaries under ICDS. Now what are the population norms under ICDS? There should be one Anganwadi center per 400 to 800 population in rural and urban projects, one Anganwadi center per 300 to 800 population in tribal projects, and one mini Anganwadi center per 150 population. So this was ICDS. It provides an integrated package of services including nutrition, immunization. Nutrition is supplementary nutrition, immunization, health checkup, medical referral services, nutrition and health education for women, non-formal education for children aged 3 to 6 years, and pregnant and nursing mothers in rural, urban and tribal areas. So they can give you option and ask you which is not under ICDS. So you must know that supplementary nutrition is there in ICDS. Now tell me this, in which year it was launched and what it is. It is Right to Information Act. So everybody is using it very powerfully, this RTI. So you all know this RTI Act 2005. This is an act of Parliament of India to provide for setting out the practical regime of right to information for citizens, and it replaces the previous one, that is Freedom of Information Act 2002. So this was very important and it was passed in 15th of June 2005. Okay, now tell me this one. So this is Save the Girl Child campaign. It is now known as the same thing, that is Beti Bachao and Beti Padhao Andolan. Okay, so it is a social initiative. It was to fight against the practice of female feticide. It is Save the Girl Child campaign. Now it is known as Beti Bachao and Beti Padhao Andolan, means it is combined to that. Now what this figure denotes, this is for Sarv Shiksha Abhiyan, that is education for all. So there are some Indian government schemes for literacy like this one, Sarv Shiksha Abhiyan 2001. All children in the age of 6 to 14 years attend school and complete 8 years of schooling by 2010. So this was the Sarv Shiksha Abhiyan. Okay. Now tell me this. This is NREGA, National Rural Employment Guarantee Act 2005, passed by Parliament to provide for 100 days of guaranteed wage employment in every year. You all know the figure also mentions 100 days. Okay. Now this is RSBY, Rashtriya Swasth Bima Yojana. So you all know this, and the contribution for central, state and BPL family, I'll tell you, central government pays 75% of total, equivalent to 600 rupees, state government 25% of total, 200 rupees, and the BPL family pays 30 rupees one time. Benefits is inpatient medical cover per family per year is 30,000, cover in case of death of the family member is 25,000. Now this is something you will require if you are going to open a restaurant or something. Food Safety and Standard Authority of India, FSSAI. So their certification is required. It was established in 2006 with its head office in New Delhi. Their function is they lay down the science behind standard for articles of food and regulate their manufacture, storage, distribution, sale and import. Okay. So it is under Ministry of Health and Family Welfare, and Government of India is the administrative ministry for implementation of FSSAI. Now this is something called multi-drug therapy for leprosy. You should know the possibacillary and multibacillary leprosy treatment. I will post in my community section. Do go and watch it from there or revise it from wherever you have read. This is the dots. So category 1, 2, 4, 5 you should know, and whatever modification have happened you should know the latest one. I'll post it there. Now this is something which is provided under one scheme. Can you name that scheme? It is provided under menstrual hygiene scheme. So this scheme has been launched as a part of adolescent reproductive and sexual health component under RCH2. Okay, these are sanitary napkins which are provided under the brand name of Free Days. These napkins are being sold to adolescent girls at the rate of 6 rupees per pack of 6 napkins by accredited social health activities, that is ASHA. So this one is important. Also, you know, one movie was made in recent times, so it makes it more important. And I think I have been talking to you since long, and I do not want it to make it boring. So I'll finish it here. We'll be seeing you soon. Till then, stay happy, stay focused, study hard, and do whatever you want. Thank you.